What are some of your favorite approaches to getting some of your patients that have this goal saying, Doc, I need to lose weight?
Yeah. First of all, I try to get them to give themselves a break. People get down on themselves.
They do.
And so we start there and say, okay, this is day one of your new life. We just eat too often. And we're always keeping our insulin high when we do that.
Yeah.
And we can't burn fat when our insulin's high.
Right.
It just doesn't happen. The two biggest priorities for anti-aging internally, loss of lean muscle, and our immune cells becoming inflamed and developing into these zombie cells.
You get somebody sleeping, their cortisol levels come down, that visceral adipose tissue, the belly fat goes away.
It's all related.
It's amazing. 15% body weight, right? Yeah. Using this, which is really impressive.
Yeah, 10 to 15%.
10 to 15%, yeah. But what they don't always share is that that's with caloric restriction and movement.
Those are the folks that just give themselves the shot once a week for 3 months, 6 months, that are losing 3 pounds and gravely disappointed and kind of sheepishly come in and say, well, I didn't do the time-restricted eating. I didn't do anything you said about the right kind of exercise or managing my stress. So 2 things.
Okay.
For cardio, I have them do HIIT,
Yep.
high-intensity interval training, 2 to 3 times a week. We're talking 7 minutes, 15 minutes max.
Yeah.
2-3 times a week max. You don't want to do this every day. You want to recover. And then, of course, strength training would be the second thing that's incredible. 4 days a week minimum, I think, to really move the needle. I don't recommend slogging away on a treadmill.
On just how 4 minutes a day of that type of exercise increases your VO2 max. When you increase your VO2 max, what that does for mitochondrial health and just longevity. And it's like, that's pretty impressive. Like there's almost no excuse to not be doing that high intensity type training.